Hey dental fam, it's your girl Leela. Who else? And welcome back to the DAStudySpot. Today we're going to be breaking down one of the most important topics of the DANB exam, ICE, infection control. Whether you're studying to take the test or you work in an office, this video gonna help you keep patients safe and pass the exam like a boss. Let's get into it. Chain of infection. Everything in infection control starts with a chain of infection. There are 6 links, and you only need to break one to stop an infection from spreading. Those 6 links are infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and the susceptible host. In the app, breaking the chain means using PPE, cleaning surfaces, and hand washing regularly. Simple moves change lives. Next up, PPE. What does PPE stand for? Drop it in the comments right quick. PPE is your personal protective equipment, aka your armor, which includes gloves, a level 3 mask, eye protection or face shield, and a fluid resistant gown. Did you know there was an order in which you put this gear on? Absolutely. First you start with the gown, then the mask, then your eye protection, and then your gloves. Why gloves last? I want somebody to drop in the comments, why do we put on gloves last? Then you're gonna remove your PPE in reverse, starting with the exactly. You always want to remove your gloves first because that's just nasty. Why wouldn't you? You don't want to contaminate yourself. You want to keep it cute. You want to stay clean. You want to stay healthy. Disinfection versus sterilization. Don't get it twisted. Disinfection and sterilization is not the same, and don't let anybody tell you different. Disinfection reduces microbes on surfaces. So I think cavity wipes on the counters, on the chairs, on the light where the dentist will grab, the air water syringe, all of that. However, sterilization kills everything, including spores. So that is being placed in the autoclave. You following me? Okay. Know what to use and when. Trust me, ICE is going to test you on this. There's also cold sterilization for items that can't be placed in the autoclave and get heat up, otherwise it'll melt. So you use cold sterilization for that. Next is sharps and biohazard waste. Sharp safety is serious business. I'm telling you that right now. Never recap needles with your hands. There is a scoop method for that or a safety cap that you can use. And you want to make sure that you always toss them in a puncture-proof labeled sharps container. You do not want to throw this in the regular trash. Anything soaked in blood goes right into the red biohazard bag. Don't piss me off and put this in the regular trash. Like, we don't play when it comes to infection control. This can cost you and your license. So you heard it. You heard it. Let's talk touch versus transfer surfaces. Touch surfaces are anything that you touch during a procedure. So think the lights, chair switches, the mouse if the doctor needs to click to go back to an x-ray, or the keyboard. However, transfer surfaces is anything that's passed between the patient and the team. So think trays, instruments, impression trays, things like that. These surfaces should be covered in plastic wrap and or thoroughly disinfected between patients because a clean op is a safe op. All right, now it's time to test your knowledge. So let's do a mini pop quiz. Question number 1, what link in the chain of infection can be broken with PPE use? Question 2, what's the right order for putting on PPE? Question 3, true or false? Disinfection kills all forms of microbial life. Drop your answers in the comments and let me know how many you got right. Also, if you're looking for a stress-free way to study for the DANB exam, check out my comprehensive study guide in the description box. We break down the exam structure while covering all key topics on the exam. It also includes a cheat sheet, sample questions, dental terminology, a step-by-step study planner, and so much more. Here are the answers to the pop quiz. Number 1, the answer is mode of transmission. Number 2, the answer is gown, mask, goggles, and gloves. Number 3, the answer is false. That's sterilization, not disinfection. If you got them all right, pat yourself in the back and we will see you in the next video. Bye. The DAStudySpot.